The CDC has documented the fact that of the COVID deaths that occurred in America, the great majority were among the elderly. What hasn't been discussed is the mental damage that took place, the psychological suffering that so many elderly people felt when their lives were disrupted, their routines destroyed, as precautionary measures were taken that often subjugated them to almost being imprisoned in their own rooms. We have over 800,000 people living in assisted living facilities and 1.5 million people living in nursing homes, and they so often bore the brunt of COVID, not just in terms of death, but also in terms of this type of suffering. Maggie, you talk about trauma-informed care as a distinction from just the symptoms of dementia or Alzheimer's or some kind of cognitive decline. What do you mean by it?
Yeah, this is a big concern for me. So trauma-informed practice or trauma-informed care is kind of a new term or kind of approach for dealing with patients' histories of trauma when they come into healthcare. So one of the things that we know about trauma is that most trauma leaves you feeling powerless, helpless, out of control. When you come into a healthcare system for some kind of need or something like that, this really amplifies that out of control feeling, right? Mm-hmm. And then sometimes we see behaviors that come as a result of that. Now, a lot of times you'll hear that talked about like reactive behaviors. Elders are coming into healthcare systems or care settings and maybe engaging in these reactive behaviors, right? And that's being labeled as a symptom of their dementia. Mm-hmm. And I think that really gives us license to go, oh, okay, well, we can just default into these controlling medical practices, right, rather than actually look at this patient and say, what's their history and how can I best attend to them?
And I think that misdiagnosis was easy to make because the symptom similarity. Mm-hmm. But when you really get beneath it, you see that they were temporarily disoriented by the disruption of all their routines. Mm-hmm. And I saw this in assisted living facilities that have many people. Well, heck, we're all aging. You know, I'm forgetting things. Heck, we're all aging. I'm forgetting. No, I'm kidding. But the point is that it's very easy as we age and accept the fact there's short-term memory loss. There's a decline in some cognitive abilities. This comes with aging. This isn't to be feared. It's to be accepted. And in the midst of it, there is the emergence of love and the caring responses of others. So it's not all bad. But I'm wondering whether our care systems are flexible enough in the future to help people with dementia be loved and welcomed and honored in care settings and not just put into settings that are overly restrictive. Right. And often they're on lockdown facilities, and they have to be because they're so-called runners, right, individuals that walk away and they're in danger. So we want to protect them. Mm-hmm. So how do we strike that balance and how do we educate professionals?
Right. It's a great question. And I think that's where trauma-informed care kind of comes in, because it's operating under the assumption that the more we know about the person's history, the more we can kind of creatively respond to the symptoms that they're bringing in. So, you know, if we see, for example, a patient and they don't like being changed, maybe they have a very strong reaction to that, a reactive behavior. If we know a little bit about their history, we might tailor the changing process a little bit. Mm-hmm. That little bit can be enough to offset the trauma that's re-stimulated for them, you know? Mm-hmm. If we have that little bit of history about them.
It's interesting.
Right. Small things can make a huge difference, Jim.
So if you're the health czar of the United States when the next COVID outbreak took place or the next, coronavirus threat, what would be the two things you do to help the elderly and not commit mistakes of the past? Mm-hmm. Anything come to mind?
Okay. Well,
I want to put you on the spot as our new health czar.
I just got promoted really fast. One, I'd be bringing in a trauma-informed protocol into all healthcare settings, and I would be training the staff. And, I think with those skills, we would see much better care for patients, and I think we would see that it would be easier for healthcare staff as well, right?
Right.
That'd be one. And then the other piece, I think, would be something around, community. How can we...
You wouldn't be a social distancer, would you?
I wouldn't, no.
No, I mean, I think that we're still paying the price for those policies, unfortunately. They were unnecessary and did so much damage, and I know it doesn't show up on a balance sheet or a CDC tally of casualties, but the reality is the damage from the social distancing, the masking, all of this was done was more traumatic for the elderly than we realize.
Yeah, and I don't think they have. I don't think they've fully recovered. There's a lot of elders who are still really afraid.